Hi guys, so I'm getting a lot of questions from patients about this crazy, incredible story, a medical miracle that's been in the news lately, locally in Los Angeles, where a patient was able to have a healthy, full-term 8-pound baby and a healthy mom that was able to recover from something known as an abdominal ectopic pregnancy. What's an ectopic pregnancy and what are the risk factors and how do we prevent this from happening for our patients? So ectopic pregnancy is a pregnancy that occurs outside the uterine cavity, and that can include your fallopian tubes, your abdomen, your abdominal cavity, your cervix, your ovaries. So very rare occurrence of implantation that's where it's not supposed to be. And so that occurs in 1% of pregnancies. And what are some of the risk factors that people have for an ectopic pregnancy? We first think of tubal disease or tubal pathology. So do you have a history of surgery to your fallopian tubes or cysts on your tubes, any damage to your fallopian tubes? Something called pelvic inflammatory disease, where you've had a history of infections that have led to scarring and inflammation in your fallopian tubes. Endometriosis, which is a chronic pelvic pain disorder that a lot of women experience, can cause fallopian tube damage and ultimately increase your risk of an ectopic. And so what some of the ways that we decrease this risk and follow patients closely is in the fertility world, we're following you from your pregnancy test because we're managing these pregnancies and we're watching it rise, bringing you in early for an ultrasound, confirming the sac is in the correct place. And if you don't have the sac in the correct place, we're immediately trying to rule out an ectopic pregnancy. We don't want these pregnancies to progress to a risk of hemorrhage, and that's one of the biggest risk factors. And we're following them closely to either do a surgical or medical intervention for your health and ultimately for the baby's health. This story is incredibly rare where both mom and baby were able to survive the surgical procedure to deliver the baby, and we're very happy for them. But again, very rare, unlikely to occur or for any physicians to see this again. And so you can rest assured that we take great care of you and we'll find those pregnancies that we call abnormal non-viable pregnancies, or otherwise known as an ectopic.